Hi, my name is Jessica Cook. I'm a physical therapist. I am the owner and physical therapist at Cook Physical Therapy here in Ottawa. I wanted to share a little bit with teachers, staff, school therapists, basically what we can do for kids who are having bedwetting, urine accidents, stool accidents at school, at home, basically how we can help support these kids in order to be more successful at school, have more emotional stability and less stressors, and overall have a better quality of life. So to tell you just a little bit briefly about me, I've been a physical therapist since May of 2013. I earned my doctorate degree from Ohio State. I opened Cook Physical Therapy in January of 2021. And that was also the time that I dove into pelvic floor therapy for women and children. So since then, I've been helping kids manage bedwetting, accidents, urinary urgency, frequency, a lot of the things that you may or may not realize that's happening at school, but you can play a very, very important role in this. So as far as accidents and bedwetting, I know that that may seem like something that you don't need to worry about at school as far as the bedwetting, but it's all connected. Basically, the pelvic floor, all of this red stuff, is a lot of muscle. And in a lot of kids, they start having a withholding pattern, which can lead back to either during potty training, whenever they go to preschool. Sometimes it tends to happen more once they get into like kindergarten, first grade. Basically, anytime there's a transition, they can be more likely to be uncomfortable in their environment where they may not be willing to take a bathroom break, or they're rewarded for staying dry or rewarded for not going to the bathroom, to where they can start this withholding pattern, which then can cause a lot of constipation. So basically, if kids have a very full rectum, if they have a lot of stool in their pelvic area right here, that pushes on the bladder, which then that means that the bladder, A, doesn't have the capacity that it should have because it's being squished by stool. And B, those bladder nerves get irritated to where then they're more likely to send up urgent signals that, oh, I have to go to the bathroom and I have to go right now. Or even though I just went 15 minutes ago, I have to go again. Or it can compress it so much that it actually causes issues at night too, because then their bladder basically doesn't stand a chance of holding urine all night long if their bladder is getting squished by stool. And then also if those bladder nerves are irritated where it's kind of hiccuping all night long. So basically that's how the pelvic floor can work. If those muscles can be tight, more often than not, sometimes there can be weakness, but if those muscles are tight, then kids aren't able to let go and be able to fully empty their urine and their feces. I know a lot of people have asked, well, why is this so prevalent now? I don't remember people having so many bedwetting or urinary issues, back 10, 20 years ago. A lot of that can be due to the change in how kids are acting now. Like there's a lot more electronics, so they're sitting a lot more. They're not getting outside and playing quite as much. The more processed our diet is and the less fruits and veggies that kids are getting plays a huge role in their bowel and bladder health. As well as if they're not getting enough water, that makes a huge difference too. So adults and kids alike, they tend to have this idea that, well, if I don't drink water, then I won't have to go to the bathroom. Or if I don't drink water, then I won't have to go as often. I'll be able to hold it longer. But that can actually be detrimental in more ways than not, because if you're not having enough fluid going into your bladder, then your urine is more concentrated, to where then it's more irritating to your bladder as well. So if you're not drinking enough water, that can actually cause more urinary issues because of the bladder irritation, but it actually can lead to more constipation, which tends to be the root cause of the urinary issues. So that's why kids, like it's very, very prevalent. You may have lots of students or kids that you know that are having these issues, but they may not bring it to your attention because it's embarrassing. A lot of kids, a lot of families deal with this all on their own. I've had many patients who their grandparents don't even know. Their siblings sometimes don't even know. Like that's a lot of pressure for kids, a lot of pressure for families, a lot of stress that I just ask you to keep in mind that even if you don't have a kid who is having an accident at school or soiling their clothes, or no kid's really going to admit to bedwetting at school, but even if you aren't knowingly aware of a child having a bladder or bowel issue, please keep in mind how extremely prevalent it is, and that most of your students will have some sort of issue, to where we need to be thinking about how we can support them. That way they can have better results with therapy. That way they can, if they aren't willing to come to therapy, then you can at least be that extra support for them there. That way they can at least start to incorporate better bowel and bladder habits. So that's a lot of what I do in a physical therapy session. I address pelvic floor, actual pelvic floor issues, like if there's tightness from that withholding pattern. I talk a lot about dietary issues, how they can change their diet, their fluid intake, to reduce triggers, stay away from certain irritants, make sure that they're getting enough good stuff in, that way they can get more stuff out. We do a lot of constipation management because, like I said, that is a big issue with most of these kids, is that they're constipated, which we'll circle back to that. But basically, I teach them how they can improve their bowel and bladder habits, how they can take care of their pelvic floor, how they can manage their pressure system. That way we can effectively decrease constipation and train their bladder in the way that it needs to be trained. Because, as I usually tell my adult patients this, but your bladder is kind of like a toddler. And if you are constantly doing bad habits, like holding whenever you feel like you need to go, or going every time at the first little urge that you get if you're running to the bathroom to urinate, you can end up training your bladder to do these things. So we spend quite a bit of time to basically train your bladder, making sure that there's nothing that's squishing it, irritating it, making sure that the whole system is nice and strong. That way we can set them up for success. So that's a quick little snippet, but basically I want to be able to show you or tell you how you can support these kiddos in the school setting, because that is very, very important. I know I've had lots of kids who they say that they don't want to use the bathroom at school. So even if they need to be responding to the urges that they're feeling, they aren't willing to go because they either don't have enough time, they don't want to ask because it's been implied that they shouldn't take a bathroom break, or that the bathroom setup isn't ideal. It's either too dirty, there aren't doors, something where they don't have enough of an environmental support, that then they aren't willing to use the bathroom. And if a kid isn't willing to use the bathroom, and I use kid loosely because it can be preschoolers, it can be kindergartners, teenagers are having these issues too. It is not just your young kids. So if you're thinking, oh, well, this doesn't apply to me because I don't teach elementary or I don't deal with elementary students, it's happening to middle schoolers, it's happening to high schoolers. They just aren't talking about it. I can guarantee that. But basically we need to make it, if we can kind of work together, or if you can help support them, even if you don't know that they need support, if you're making it a better environment for them, then hopefully that will help the kids that need the help, but they just won't have to actually admit to it. But if you can provide bathroom breaks, ideally every 2 to 3 hours. So I know that there's, like, the school schedule's busy, you have only a couple of little minutes between switching periods, but at least if you can have an understanding if a child is going from one end of the school to another end of the school, and if they don't have time to go to the bathroom during that little break, if they come to you and say, hey, can I use the bathroom? Then please be flexible with that, because I'm trying to teach them how to listen to their body. So if there's any OTs in the crowd here, interoception is a sense that we basically is telling our body what we're feeling. It's taking information in and turning that into what that means. So for, like, adults tend to do a lot better with this. You know that whenever your mouth gets dry, your body can sense that information and turn it into thinking, oh, that means I'm thirsty. I need to go get something to drink. Or if you feel your belly growl, or if you feel yourself getting hangry, your body can sense that, internalize it, and turn it into, okay, that means I need to go get a snack, or I need to get some food. Bowel bladder interoception is a whole lot trickier. It's even trickier for adults, because if you think, okay, well, how do I know whenever I have to pee? How do I know whenever I have to poop? Sometimes it can be really hard to quantify that or explain that. So if it can be difficult for adults to be able to listen to those cues all the time, it's way harder for a child to be able to not only recognize that, but then respond to that. So if we're working on ways that they can start reading their body better, if we're starting to get that urge back to where it's like, oh, I do have to use the bathroom. But then if they know that, well, I can't use the bathroom until I get home, then that's basically undoing the things that we're trying to get them to do. So I ask that if you can be more flexible with if a child comes and says, hey, I need to use the bathroom, they're probably doing that in a way to better understand what their body is actually trying to tell them what to do. So that can be one thing, because ideally, whether it's kids, adults, we should be going to the bathroom every 2 to 4 hours. That is what normal bladder health is. We shouldn't be able to stretch 6 hours before we go to the bathroom. We also shouldn't be going to the bathroom every half hour or an hour. So we want to find that middle zone where we can listen to our body and say, oh, I need to go to the bathroom. I should take the time, like it's been a few hours, I should take the time to go now. A big part of that can be if kids, adults too, but if kids are hydrating well enough. So if you are able to go from 8 until 3 o'clock whenever you get out of school, if you're able to go that long without going to the bathroom, then that's a big sign that you need more hydration. We need that hydration for bladder health. We need it for bowel health. You need it for so many things, headaches, migraines, general tissue health. You need hydration. So if you're able to go that long, then that means that you're not getting enough water. You're not getting enough fluid. And I know I've had more than one patient say that they're not allowed to have a water bottle at school. That if they're thirsty, then they can just go and get a drink from their drinking fountain. I understand that there are some things why certain age groups especially are not wanted to be able to have a water bottle at school in case they're bringing something else in. But if you think about the vast majority of the students and for general health, we really want them to be able to hydrate, because otherwise it affects them in every way. They're going to be more fatigued, they're going to be more irritable. If they're not hydrating, then they're not taking care, they can't be making good, healthy decisions. So I urge you that if you're a school that doesn't allow water bottles, if you think a kid is going to get enough hydration during a quick period break where they're going to run to the drinking fountain and get a few sips, that's not nearly enough. We need way more hydration than that, to where we should have to go to the bathroom at least every 2 to 3, maybe 4 hours. So that can be something that you guys can do too, is that you can try to promote hydration if you're willing to let them have water bottles. That can make a huge difference. Another thing that I've heard from some patients is that some students are rewarded for not having to use the bathroom, almost like it's a reward system for if you don't use the bathroom, then you get extra rewards, or that if in any way you're penalized for needing to use the bathroom pass. Again, that's promoting poor bathroom habits. I know that some of that is probably to not let kids mess around. Of course, kids, if they are bored in study hall and they want to go to the bathroom and mess around, like that, I understand that. I didn't go to school that long ago. I get that. But at the same point, I can't get these kids to be better if they are feeling like they are going to be shamed if they use a bathroom pass, or if they can't take a break to be able to go do what their bodily functions are. I know a lot of teachers, a lot of medical professionals, they don't get to listen to their body either. That's not good. We don't want to train our bodies to not have to go to the bathroom. I know that in a lot of cases we can't help it. It's what our profession is. But maybe teachers will have better bladder and bowel health too if we can be a little bit more flexible with allowing to have a bathroom break every once in a while. So I hope that can help kind of give some insight as to what pelvic floor therapy does for kids with leakage and bedwetting and constipation. I hope that can give a little bit of information about what you can do at school. There's a lot of great things that if you're a PT or an OT in here that you can work on interoception. That would be great. Pelvic floor stretches are a great way to be able to get more mobility down into, so like playing in certain positions like Like a frog squat can be a great way to get some good pelvic floor mobility without necessarily having to think about pelvic floor mobility. That can be a great pose. I have a lot of kids do like a sloth pose where basically like happy baby, but they're playing like a sloth. That can be a great way to get some good mobility at their pelvic floor. And that's what a lot of these kids need. They need some relaxation. If they have any anxiety, or whether it's if they're kind of ramped up in fight or flight mode, either due to school issues, home issues, you tend to hold that in your pelvic floor. Adults do it too, where if you are like type A perfectionist, if you're go, 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 most oftentimes people will hold that tension either in their neck and shoulders, in their jaw, or in their pelvic floor. Kids are the same way, especially middle schoolers, high schoolers, they're the same way. So if you have kids that are having frequency, urgency, if they are having any sort of accidents, or if any parent has indicated that, hey, we're going to pelvic floor therapy, please just have a little bit of extra patience with them, because we want to be able to get these kids feeling as good as we can, because then it improves their emotional health. That's one thing that insurance companies tend to not think that something like bedwetting is an issue, because it's physically not damaging the child. I would strongly disagree with that, because the emotional toll that I see on these kids whenever they come in here is so significant. I've had kids that won't even look at me whenever they first come in on that first day, because they're so embarrassed and so ashamed of something that they can't control. I mean, you cannot hold in your urine or your feces if your nerves are so irritated or your rectum is so stretched that you physically can't feel whenever you have to go. These kids can't help it. There's even a book. A lot of families really like this book. It can be overwhelming in a sense for somebody who's not trained with some of the stuff, but it's called Bedwetting and Accidents Aren't Your Fault. And it is so true. Kids can't feel it, so they can't control it. So the emotional toll that they have, something that they might be getting blamed on doing it on purpose, they might be getting teased for things. The emotional toll is so strong that we want to support these kids however we can. We want to be able to set them up for success. That way they can improve their emotional health, their physical health. They'll be more confident if they know that they don't have to constantly be worrying about a leak or worrying that they got left out of a sleepover because they're going to wet the bed. We can help these kids improve their quality of life so much. And I've seen it so many times where like suddenly they're more confident. They're like, yeah, I haven't wet the bed in a whole week, or I haven't had any stool leaks since the last time I was here. Those sorts of things are life-changing, and you can help be a part of that, because it makes such a big difference. So feel free to reach out to me with any questions that you may have. I know that a lot of those things might not be big, crazy ideas that will be able to make a huge impact right away, but I ask that you can have patience and kind of have an understanding that if somebody is asking to use the bathroom, and if they genuinely seem like they need it, or if somebody is embarrassed to come ask for a bathroom pass, keep that all in the back of your mind, that these kids might be dealing with something way more than what you realize. And it makes such a big difference on them, and you can help make a big difference in their life. So if you have any specific questions, you can always reach out to me at cookphysicaltherapy@gmail.com. You can also, I have an online website. It's cookpt.com. It's KOCHPT.com. I have online scheduling. If you have kids that you think may be appropriate, that they might benefit from an assessment, you can always send them my way, and then I can ask them questions. I want to be an open book about how we can help these kids as best as possible. So thank you for your time. I appreciate it, and let's get these kids better.